This is Nevada Health. I'm Michael Easter. Your teeth tell tales. Dentists can spot impending health issues like dementia, heart disease, diabetes, osteoporosis, and many other problems just by looking at your teeth. What's more, people with nice, straight teeth may be more memorable and more likely to land a job, according to recent studies. The new science of your teeth is our topic today. Here to talk to us is Dr. Paul VreNon. He's a dentist, the founder of Desert Breeze Dental, and Las Vegas's only dentist accredited by the American Academy of Cosmetic Dentistry. Dr. VreNon, welcome to the show.
Well, thank you.
How long have you been practicing dentistry in Las Vegas?
I've been practicing dentistry in Las Vegas for 17 years.
When a person comes into your office for just a general checkup, what are some of the first questions you ask them, and why do you ask those specific questions?
Okay, they have a specific form that they fill out about their dental history, and I kind of go through that form and I ask about their periodontal health. I ask about their structure of the teeth and how many cavities they've had in the last few years. I talk about their bite. I ask about their aesthetics, their dental facially, what they look at, and the reason that they came to the practice, because everybody comes to my practice for different reasons.
Mm-hmm. Do you find most people, in other words, out of all your patients, how many stick to the recommended checkups, or are most coming in because something's happened?
We have a good recall rate because nobody leaves my office without an appointment. So I would say probably a good 80% follow the regime that we do. There's some few non-compliant patients, but yeah.
Yeah, and how often should the average person be going to see their dentist?
The average person should be going every 3 to 6 months, depending on their oral health status, but the average population should be at least twice a year, every 6 months. People that have increased periodontal disease or increased caries risks, they should be coming either every 3 to 4 months.
Wow. So when you go to the dentist, you usually get a teeth cleaning. Is that something what's the reason for that? I feel like when I do it, it feels like they're digging deeper into my gums and teeth than I could ever do myself, but I'm wondering sort of what's the benefit and rationale behind that?
Okay. So I personally don't refer them to cleaning. I call them the hygiene visits with and without periodontal disease. The main purpose is to remove the biofilm that actually causes the cavities in the mouth and it causes the bone loss around the teeth. So those are the two reasons for the hygiene visits.
I see. Do you find that healthy teeth are often a marker of general health?
Yes. The Mayo Clinic says it's the window to overall health. Some people out of Michigan says the mouth actually mirrors the body.
Oh, interesting.
So, and there's many systemic diseases that have oral manifestations.
What are some of those?
People that have periodontal disease have a lot of coronary problems, cardiac vascular disease problems. People that are pregnant have adverse pregnancies. So they're all interrelated.
Interesting. So how could you tell if someone was potentially having cardiovascular issues by looking at their mouth?
You couldn't actually tell that they had cardiovascular issues from their health, but it's a contributory factor. Somebody that has a lot of plaque and calculus, red bleeding gums, those are all things that can manifestate in their veins and arteries and cause cardiac problems.
Okay, got it. So it's more a sign of it. Just because someone has that plaque doesn't necessarily mean that they have heart problem, but if you see it, it could indicate there might be.
Yeah, contributory factors. So if you take their blood pressures and they have elevated blood pressures and other things, you might want to, if they haven't seen a cardiologist or an internist, they might want to go get an annual physical and have that checked.
Mm-hmm. What are some other things that you can see just by looking at a person's teeth?
First thing, the general thing is I check and I see if they have inflammation. I look at the length of their teeth. I look at odor. I look at plaque and calculus. That's all the periodontal standpoint of the gum and the bones. The next thing I look at is the tooth structure, which is basically the biomechanics. Do they have decay? Do they have caries? Do they have broken restorations? Things like that. We dentists call it the function of how the teeth work together and interrelate, known as the bite. If there's a lot of worn dentition or people are having a lot of jaw pain or TMD problems, it could be they have multiple bites so their teeth are worn. The last thing is dental facial, which everybody wants to look the best. That's why they want veneers. That's why they want whitening. We look at the aesthetics, the color, the shape, how much tooth display they have. So it's all incorporated, and they have to be in a harmonious relationship to work well.
That makes sense. So you also mentioned bad breath. What could that potentially indicate?
I relate bad breath to their hygiene. We have a lot of things. The biofilm actually sticks on the teeth if you don't clean and brush your teeth very well. There's a lot of fibers on your tongue that actually people don't clean and scrape their tongue that harbor bacteria, a lot of gram-negative bacteria. So it's very important to brush and rinse your mouth out.
Oh, interesting. Should you actually be brushing your tongue as well, or does that get taken care of just with general brushing?
No, you should be brushing your tongue. And they actually make tongue scrapers to actually scrape all the plaque and the disease off the tongue.
Oh, interesting. Do you recommend those?
Yes, I do. My hygienist gives them to almost every patient.
Oh, really? Nice. You also mentioned bite, and you might see some wearing in teeth. With people who grind their teeth at night, do you have any sense of why people do that and the issues that can stem from that?
There are several issues. Everybody calls it bruxism and puts it in general, but depending on how their teeth line up, we classify it as wear in the front, if their teeth are wearing in the front, if they have wear in the back, or if they have a neurologic problem or they take medications that cause them grind. So there are multiple reasons why people grind their teeth. It's just not one. And defining that reason is very important if you're going to fix the problem.
So you mentioned it could be some lifestyle factors, but it could also be something like a medication.
Medication, or it can actually be from car accidents and basal ganglion, the trauma. It's in the brain. People actually do that after they've had injuries.
Oh, wow. So if you had a patient that perhaps wasn't experiencing those symptoms, and they come back into you and you notice some evidence that they have been grinding, what's the typical steps that you take with them?
We usually kind of find out why they're grinding. We make them an appliance and see how they're grinding. If it's a tooth problem, if it's a muscle problem, or if it's a joint problem, and kind of isolate that, because you can't just fix the worn teeth if you don't know what the problem is. And that's the number one thing I find in dentists is they want to fix the tooth, but they don't know what caused the problem. You need to find out and fix the problem first before you fix the tooth.
A lot of people are taking the Band-Aid approach more or less without...
Correct, and it's just going to happen again.
Yeah, that makes sense. Do you have any stories about patients who have come in and you've potentially caught a medical problem by looking at their teeth?
Yeah, I've caught a few people with oral cancer. I had an MD that was getting ready to retire, and I actually saw some white lesions on him, and we actually sent him to the oral surgeon, and we found out that he had oral cancer. So he got treated for oral cancer before he retired and moved to Florida, and he's actually still alive. So catching things early are very important, not necessarily just in caries and decay and periodontal disease, but also in cancer and other things.
Mm-hmm. You're listening to Nevada Health. We are speaking with Dr. Paul VreNon, a dentist in the Las Vegas area. Is oral cancer, is that something people tend to get only if they're smoking or chewing tobacco or drink, some of those common lifestyle factors, or do you tend to see it in everyone?
Everyone is basically predisposed to getting oral cancer, but there are things like drinking, smoking that can accelerate that. But a lot of people that have never drank or smoked have got oral cancer before, so catching things early is a very good thing.
I would imagine with a lot of those people, they're probably not aware that they have the risk factors. For example, if I chew tobacco, I probably am aware that, my oral cancer risk is higher, whereas if I don't, I may just overlook it. So it seems like regularly visiting a guy like you might be able to catch that earlier, whereas I might not even be, it might not be on my radar.
Correct. And with DNA testing today, genetics plays a huge role in dentistry. So you can get tested for periodontal disease and genetics. You could get tested for your caries risk, and you can also test if you're more susceptible to certain types of cancer. So if you want to spend the money, you can get some DNA testing and get your genetic, if you're a genetic carrier for those diseases.
Interesting. Do you ever recommend people do that?
Oh, yes.
Yeah?
Yes.
How many of your patients do that?
Very few. People don't want to spend the money. They don't want to be proactive. But the concierge medicine is really trying to push people in that direction, both not just in medicine, but also in dentistry. So the people that really care about their oral health do that. Mm-hmm. And I think that's going to be something to really benefit people in the next 5 to 10 years.
Yeah, that'll be a new phase. How much do those genetic tests tend to cost?
They run anywhere from a couple $100 up to about $7.
Okay.
So
I would imagine they're probably not covered by insurance, right?
True.
You talked about how those might be at the cusp of this new technology that we're using to improve people's health. How has the practice of dentistry changed since you first started your career?
It's changing at warp speed. Technology is changing so much. We have actually CT scans, and I'll review those a little bit. They have scanning technology versus old type impressions. Magnification is a huge part in dentistry. We have robotics for implant placement, and there's also a lot of digital stuff like digital smile design, which is really helping dentistry sell cosmetics and stuff. But the technology of dentistry is changing every year. There's something new and better every single year. So if you're not taking courses and staying up on that, it's a huge thing. We used to take traditional x-rays to basically diagnose people's problems and see. But now we can do CT scans and we can look at the quality of the bone, how thick the bone is. And even in the endodontists these days, the good ones have CT scans. So before they even go in the root to do the root canal, they can actually look at that root 3D, tell you how many roots is there. Is the decay outside the root? Is it inside the root? And where everything is. So the technology really gets a better success rate for long term.
Oh, wow. I would imagine with that technology, it's like you already know what you're going to find before you go in there.
Basically.
So then you can maybe plan to do your procedure in such a way that, you know, could maybe help someone recover quicker or any number of things.
And a lot of times they would think things were inside the root that they would see on x-rays, and it was actually outside of the root and the tooth was non-restorable. So it's saving patients and doctors a lot of chair time and cost and money.
Oh, wow. Interesting. Are you using those in your own practice?
We send out for CT scans, but we do a lot of the scanning technology. A lot of people used to gag on impressions and things like that. So you can actually scan their mouth for crowns, restorations, and things like that. So
interesting. You also mentioned robotics. Tell us a little bit about that. How does that work?
Robotics has been around in surgery and medicine for a long time. But this year at the oral facial conference in Miami we went to, there's a couple companies out there that are putting in robotics. It's basically controlling where implants are placed by digital CT scans, and there's no room for error. Your hands don't shake. You're basically playing a video game, putting them in with surgical guides, and the precise and accuracy is phenomenal.
Do they tend to be getting a lot of good reviews from the dentists who are using them?
It's new technology this year that I've seen. It's probably been out for a year or two. I haven't heard too much about the reviews on it yet. So probably in the next couple of years, you'll start to hear and see more of it.
Mm-hmm. What's the barrier to entry to some of this new technology? Is it usually hard to adopt because of cost? And how do you find people in the industry actually adopt these things?
Cost is a big thing. Most of the specialists seem to get that first. The general dentists kind of stay away just because of the cost. If you're only placing less than 100 implants a year, you're not going to want to spend that kind of money on the technology. But if you're placing 2, 3, 5, 1,000 implants a year like these periodontists and oral surgeons on, they would want to kind of invest in that technology.
Mm-hmm. That all makes sense. You mentioned getting away from traditional molds and impressions. What kind of technology is replacing those?
They're scanners. It used to be one company out there, Sirona, that developed a CEREC. They've been around for about 32 years, I believe, maybe a little longer. They had the patent on scanning, but now there are so many companies out there for scanning. So you can scan arches in dentistry for Invisalign, for ClearCorrect, for crowns, inlays. You can scan almost anything, and there's multiple companies out there, and the patent ran out, so the technology is really coming down in price. The scanners used to run about $150,000 to $180,000. Now you can get good scanners out there for about $30,000, and they're small and they can be used on laptops.
Oh, wow. So it's almost like we saw the prices of TVs when flat screens first came out. They were, five figures, and now you can get one for a few $100.
Yeah. And so you can actually scan somebody's mouth for crowns, for Invisalign. You can check it. You can send it over the internet. The lab that you send it to can get it. They verify everything, and you approve it or not, and then you can get something mailed back within a week. It's amazing, the technology.
Oh, wow. So I would imagine it's reducing costs, improving outcomes, and also making things a lot faster.
Yes. But it is case specific. What you put into it is what you get. So you have to have a good prep. You have to have good isolation. You have to good teeth. I mean, if you send a bad scan, you're going to get something bad back. So that you still have control, and the dentist has to be very meticulous on how they do things.
Mm-hmm. It sounds like you really need to know how to use the technology.
Yes.
So how do you keep up with all this evolving technology.
It's a constant effort. I try to go to CEs every month, but there's a couple big groups out there. The Academy of General Dentistry has constant training out there. The American Dental Association has constant training. A lot of the cosmetic stuff is the Academy of Cosmetic Dentistry. Every one of these organizations have an annual symposium, and they bring lecturers from all over the world. This past year, the Academy of Cosmetic Dentistry had their annual thing here in Las Vegas, and they brought some of the best dentists in the world from whether it's Brazil, Canada, wherever, and that's where they teach people about implants, they teach people about their bite, and most of all cosmetics. And that was the award ceremony this year, and I became accredited in Las Vegas, which was pretty humbling since I'm only the second dentist in the state to ever be accredited, and there's less than 400 worldwide, and I don't think anybody's ever been accredited in their hometown, so it was pretty special to me.
That's great. Tell us a little bit more about cosmetic dentistry. How do you differentiate it from normal dentistry, and what's the average patient there?
I really don't think there's an average patient. Everybody wants cosmetic dentistry from 16-year-olds up to basically 70-year-olds. The first thing is people want to have a nice smile. It gives them a little confidence. And the art of dentistry is very specific. You want to have white teeth, you want to have straight teeth, and you want to have age-appropriate teeth. And that doesn't mean you have to cut the tooth down and put a crown on it. There's very conservative veneers. You can actually do bonding to enhance it, or you can just reshape teeth and whiten them. So cosmetic dentistry is different for every person.
You're listening to Nevada Health on 91.5 KUNV. We're going to take a short break, and we'll be back. We're back on Nevada Health. We're talking to Dr. Paul VreNon, a dentist in Las Vegas. Is this sort of cosmetic dentistry you were telling us about usually covered by insurance, and how does that work?
Cosmetic dentistry usually is not covered by insurance. Some insurances do cover a little bit of it, but most of it's for preventive and decay. So that's mostly out of pocket. And insurance really doesn't cover that much these days. It's a benefit basically for 2 hygiene visits and maybe fix a tooth that's broken or something.
You mentioned it can prevent decay, though, so you could almost look at it as potentially an investment.
Yes.
In the long run.
Mm-hmm.
Interesting. How does it work by preventing that decay?
People that have basically worn dentition or potholes in their teeth or fraction, the enamel layer is hard, but once you get into the dentin layer, which is a lot softer, and then drinking sodas, eating sugar, diet, that decay in tooth structure can actually soften up and start a decaying process.
You just mentioned 2 of my favorite things, soda and sugar. What are some of which leads me to my next question, unfortunately. What are some of the worst foods for your teeth?
The worst foods for your teeth are basically mostly are sports drinks, carbonated sodas, citrus fruits, hard candy. So really the acidic stuff and the carbonated stuff are the real bad things.
And why is that?
The acidity basically is just hard on your teeth, and then the sugar actually promotes the decay process.
Oh, interesting. So it sort of breaks down that enamel layer? Is that what's happening?
Correct.
And then that exposes the dentin, the weaker layer,
mm-hmm.
which the sugar can then attack more or less.
Correct.
Got it.
It can attack the enamel layer, but it takes a little longer.
That makes sense. And what's the problem with sodas? Because we need to talk about this, because I drink a lot of diet soda. So what are the problems there? Is it the sugar in the soda? In other words, am I okay drinking diet soda, or is it something inherently bad about the sodas?
There's a lot of the sodas are different. They have a high sugar content and a high acidic content. So it just depends which soda. I know like Mountain Dew and Red Bull are kind of the worst sodas, and all the sports drinks because of the high sugar and the low pH. So
in other words, I should stop drinking so much soda.
I think it's okay. You can still drink soda, but you want to maybe rinse your mouth out with water and then brush your teeth afterwards with the fluoride and then to remineralize that. So, and I really recommend prescription strength fluoride instead of over the counter, because that actually hardens your teeth and strengthens them to prevent these kind of things.
Oh, wow, that's interesting. How do you get a hold of that?
Any dentist can prescribe it for you as a prescription, or most dental offices sell it. Prescription strength fluoride, and we do it to about 90% of our hygiene patients. The ones that are compliant really come in with less caries, less periodontal problems, so it's a win-win situation for both.
Oh, wow. Are those products generally a little more expensive than normal toothpaste?
Uh, $17 to $20
Okay.
and that toothpaste will last you, or gel should last you 6 months.
Oh yeah, so
And
really worth it in the long run.
I think it's a best investment. It's better than dental insurance.
We might want to underscore that last point you made. What do you find are the biggest things that people do wrong when caring for their teeth?
Probably the number one thing is they don't come in for routine hygiene checks. Catching things early can really save time and money for patients, and using the prescription rinses, whether it's fluoride or some other products that actually keep your mouth a little cleaner.
How does flossing come into the equation? Is flossing something you really recommend?
Yes, I think flossing is very important. It cleans the biofilm. It can prevent caries in between your teeth, and it also helps lessen the effects of periodontal disease. So flossing is important. There are some people that think that flossing can't fix a microbiological problem, but you do get some benefit. It's better than not flossing at all.
Is there an easier way to get the same effect without floss?
The only other option would be water pick. So as long as you're flossing or have a water pick, I think you're going to get pretty much the same result.
Okay. Is a water pick something you recommend?
Yes, my hygienist do.
Okay. Nice.
I recommend it, but compliance is a big thing. People buy stuff and it just sits in their bathroom. So if you're not getting the benefit if you don't use it.
That makes sense. Have you figured out any tricks to get people to buy in? Or in other words, the people that do buy in, what do you tend to see in them, why they might be buying in?
They really are conscious about their oral health. My hygienists are well trained, so they kind of educate people. You know, if you don't have any oral health, you don't have any health at all. So they're just more proactive approach.
That makes sense. With kids, how do you get kids to remember to brush?
That's the hard question. So you have mechanical toothbrushes electric toothbrushes that you can help kids that are kind of funny. We have timers and things like that. But I think the parents need to set a good standard and have their kids brush every morning and night. And some kids even brush at school, take one in their bag at lunch and brush at lunchtime. So those are good habits to start.
Yeah, those kids get a gold star. We were just talking about sugar and soda. If you tend to eat those foods a lot, is there any ways to mitigate the damage? You did say brushing afterwards. Are there any other ways?
Not that I'm aware. Really keeping your teeth clean, brushing.
Yeah.
Mm-hmm.
Rinsing and then brushing afterwards. Mm-hmm. In terms of staining, what foods tend to stain people's teeth most often?
I think all foods tend to stain. Basically, keeping your teeth clean, brushing them removes the biofilm that actually causes the stain. But some of the stronger stuff are the berries, the pastas, the curries, some exotic foods that have different dyes in them can cause teeth to stain. And of course, the top four are the coffees, the teas, the sodas, and the red wines.
That makes sense. Basically, the foods that when you spill leave a stain on your carpet are the same ones that...
Correct.
So you mentioned it sits on the biofilm, and that act of sitting there is what actually leads it to stain.
Yeah, your teeth are basically like sponges. They have little tubules that go all the way in. So the longer that sits on the teeth, the deeper they get in the tubules. So it's just like a sponge. And that's why people think that whitening is going to work. Like after you whiten your teeth one time, it takes several visits to get that stain out of your teeth.
Oh, interesting. So what are some of the best ways to whiten your teeth?
All whitening systems work. Everything has some kind of hydrogen peroxide component in there. So basically, over a time period, you just have to be consistent over time to whiten your teeth. You have the home trays that you can take home that are custom made to your mouth that work well, that you put gels in them. You can go into the offices that have either laser or halogen light to activate the materials. And then you also have like the Crest white strips. They're basically, you can buy over the counter. They're not as strong as the ones you can buy in the dental office, but it's a good opening point to see if your teeth will whiten and whiten up. So some people's teeth are genetically predisposed to have stains, whether they had fevers when they were little, fluoride, or even some kind of antibiotics when the teeth were developing, and you really can't whiten those all the way out.
What causes that staining that might have occurred in childhood?
A couple of the ways that those happen in teeth are, the number one reason is people that when kids are sick, they give them antibiotics. They used to give them tetracycline, and that would be systemically developed in the teeth as the teeth are developing. So those tetracycline stains are a common thing. So they try to stay away from those type of antibiotics these days. Also, fluoride was given too much. They had the drops and the tablets basically in the 60s and 70s. And so when the teeth were developing, they had fluorosis. So they had a lot of brown marks, white marks, and hypocalcifications. Even though the teeth were strong, they had a lot of discoloration to them. And then also the other thing that I've noticed with people is they've had fevers or trauma when those teeth were developed. And those are the issues that I see. But the number 1 and 2 were the tetracycline and the fluorosis.
Interesting. What's the most effective way to whiten your teeth?
Just a traditional whitening system that basically is custom fit, and put a little bit of bleach in there and wear it every day or every night over a consistent period of time, and everybody's teeth will get white. But there are a lot of, I would basically call voodoo systems, where it's charcoaling and all the stuff that I see on the internet. And dentists just roll their eyes when they see those kind of things. But just some kind of hydrogen peroxide paste that they put in a tray and wear. That's about the number 1 whitening system out there.
That makes sense. You mentioned some of those voodoo methods of teeth whitening. Can those actually cause problems, or is it more just like you're throwing your money away?
I'm not sure. I haven't seen any people use them, but I hear them and I see them all over the internet.
That makes sense. So we live in a town where UFC is big, boxing is big. Do you see any fighters?
No, I personally haven't seen any fighters, but some of my friends and dentists have. They've seen me, everybody from Mike Tyson, and one of my dentist friends is good friends with Dana White, so he sees a lot of the UFC fighters and stuff. So.
Oh, interesting. How do you prevent losing teeth if you're in a combat sport, or even just a general sport if you're a kid playing football or basketball?
Mouth guards are the number 1 thing. And it's not just for losing teeth. It actually prevents concussions too. And I've seen people lose teeth just in the NBA Finals this year. Isaiah Thomas from the Celtics got hit, and his tooth came flying out. There was one other incident I saw that was flying out. But just custom-made mouth guards are probably the most important thing. And you see a lot of NBA players, whether it's Steph Curry. Steph Curry. He wears them. He chews on them all the time. But they wear them to prevent them. There are different thicknesses, and they're made for different sports. So the level of sport needs to be the level of thickness on that.
Oh, interesting. So if you're in a combat sport, you'd probably have something a little thicker. Whereas if you're in, I don't know, basketball maybe.
And they can be custom made.
Interesting. Yeah. So with that customization, is that like it's just fitted for your exact teeth?
Yes, and you can have them for the top and the bottom or both. The problem with it is some of these athletes that wrestle and do things, they have a breathing problem, so they're trying to develop ways that these mouth guards can actually help them breathe too while they're in combat sports or exercising.
Oh, interesting. How do they help prevent concussions?
Just from the trauma of the teeth banging against each other, the hard impact. There's a couple academies out there, just like the Academy of Cosmetic Dentistry. There's the Academy of Sports Dentistry that basically is devoted to protecting teeth and preventing concussions. And there's also the International Association of Dental Traumatology. And most people that are affiliated with either college or pro sports have to be affiliated with these dental institutions or dental.
Well, Dr. VreNon, thank you so much for coming on the show today.
All right, thank you.